I thank you, Mr. Chairman. This Congress and the last Congress are at odds about health care. It's a fundamental question of fundamental importance to the people of this country. The last Congress passed the Patient Protection and Affordability Act. The first act of this Congress, the House of Representatives, was to repeal that act. We've got disagreement about what should be done. The House legislation is pending in the Senate, likely to go nowhere. This legislation before us today is a further effort to try to unravel the law that was passed by the House, the Senate, and signed by the President last year. Acknowledging that there is a serious debate within this body about the future direction of health care, this amendment would allow for the state health exchanges, where there have been applications by 13 states for early implementer grants, to go forward. It would exempt from the defunding $1.9 billion that would be then subject to appropriations up to that amount. It wouldn't guarantee it. It would be subject to appropriations. My preference, quite frankly, was to make that mandatory as it was in the original bill, but that was not permitted under the rules in order to make this amendment in order. The advantage of doing this is it does, and I speak to my friend, the gentleman from Texas, it allows the local states to be making decisions about how best to design their health care. And just to go through some of the recitation by the gentleman from Texas, the early innovator grants have been awarded to 11 states. Again, it allows them to decide what's the best design of these health exchanges. And these states include what we might call red states and blue states. It's Kansas and Wisconsin. It's Maryland and Massachusetts. It does include Vermont, my state, that has taken on responsibility to try to move forward to design a health care system that's good for business, good for consumers, and good for taxpayers. So the fundamental question here is, do you think that states can be a laboratory of experimentation and policy? The states take action, they implement a plan according to the design in Boston if it's Massachusetts, or Hartford if it's Connecticut, or Tulsa if it's Oklahoma, or Montpelier if it's Vermont. And the folks in that state, where they have fundamental responsibility for the citizens of that state, will be making the decision. This allows us to be partners with the states where they take on this responsibility. They get some help from the federal government to implement these early these health benefit exchanges, and we are allowed then to basically get the benefit of the federal system where states make decisions, the federal government is a partner. And I reserve the balance of my time.
Gentlemen.
Thank you. I want to talk a minute about Social Security. Social Security, you have access to Social Security whether you live in Texas or you live in Vermont. It's a program that benefits every single citizen of this country. And the underlying premise of Social Security is that we're all in it together. We all pay into the benefit program and we all benefit, whether you're rich or whether you're poor. We're all in it together. Our amendment acknowledges that this is a stronger and better country if all of us have access to affordable health care, whether you live in Texas or you live in Vermont. So yes, it is true that in the Welch Amendment, we maintain that national commitment to all Americans being covered and all Americans benefiting by access to health care, which we know they mean. But what it also does is say that in the implementation, in the delivery of health care, driving decisions and authority down to the local level will help us be successful. It will allow states to show that maybe they have a better way of achieving this goal of access to health care for every citizen in the country. So, yes, I say to the gentleman from Texas, we do embrace in my amendment the concept that every American should have access to affordable health care. But what we also do, I say to the gentleman from Texas, is acknowledge that states can experiment, that folks at the local level may have a better way to make decisions and actually to deliver care. And if they design a plan in Texas to do it one way, and we design a plan to do it in Vermont another way, why not? Why not let the states figure out how best to make good on this promise to America that every one of us can have access to the health care that we need. I yield back the balance of my time.
Gentleman yields back.